Welcome students, welcome again. We have an interview with another topper. Dr. Haripriya has got 17th rank in FET exam, FET 2020. And she has chosen Baptist Hospital, Bangalore for Reproductive Medicine Fellowship in National Board. So that's a wonderful center. Congratulations on this wonderful score, wonderful rank, and lovely institute that you're going to do your fellowship in. Congratulations, and let's hear your story. Let's hear about yourself and then how you decided, how you studied for this to get such a beautiful rank. So Dr. Haripriya, over to you.
Hi ma'am, I'm Dr. Haripriya. I did my undergraduation from Gandhi and post-graduation from Osmania, both Hyderabad.
Right.
I was not sure what I should be doing next, like I should take an F&B or fellowship.
Which year did you finish your post-graduation?
I started in 2017, ma'am, finished in 20.
Right. So you finished in 20 and the next exam, just you cracked the next exam which you took.
No, ma'am, no. I did a SATship.
Okay.
And then after that, I was not sure what I should be doing. Like I was not able to decide what should I be doing, like reproductive medicine or oncology or F&B or fellowship. I was confused at that time.
Okay. And then how did you decide, when did you decide that you will prepare for these exams?
Finally, in August, I decided I'll start preparation for F&B, reproductive medicine.
So that was how much after your, what period after you completed your post-graduation?
After I completed my post-graduation, around a year. After
a year later, you decided that let's start studying. So in August, you decided, what did you decide?
F&B, reproductive medicine.
Okay, you decided to do reproductive medicine, F&B. And then how was your preparation?
I asked a lot of people. They were saying, read Spiroff, you must read Spiroff. So I read the whole Spiroff and parts of Williams obstetrics and gynecology, ma'am. But the thing was, I was not able to remember, or the revision was becoming impossible. The more topics I read, the revision was becoming impossible. And then the exam dates came and I was so tense at that time. I didn't know what to do, but luckily the exam got postponed.
Yes, that all the toppers are saying. The exam got postponed and they prepared during that time.
Then I understood that what I have to do is I have to read a lot of content in a short period of time.
Yes.
That is it. Then I took Repronate 1 month before, but I was reading. I didn't listen to any of your classes. Then after 2 months, I started, like 3 months before the exam, I started listening to your classes. I made 3 notes after them. I used to revise them every day.
Okay. So you were practicing in those 3 months? You were working?
No, ma'am. I was not. Okay. I was not.
So you had decided that you will do FNB anyhow? You were just studying for the last 3 months. That's wonderful. So 3 months.
I only listened to your class, wrote down the notes. I used to read the notes in half a day. I used to revise at least once a week. I used to revise all the notes.
That's so wonderful. So the entire notes you would revise every week?
Yes, ma'am. Every week first.
That is a lot of revisions. For 3 months you've been doing this?
That is how I got. I only did your notes and your questions. I thought I'll complete your notes in around 2 months. Maximum 2 months. Okay. Last 1 month I thought I'll revise.
That's very fast. I think because you had read Spiroff and Williams, it was easy for you to finish.
I couldn't complete it, ma'am. It was so extensive. That's the thing. I couldn't complete it. But because I kept revising every week, all the notes.
So whatever you read, you would revise every week.
Yes, everyday revision is a must for me, ma'am. Because that is what I understood. If you want to answer in the final exam, you have to be able to recollect everything you've read.
Yes, that's right. Reading is not important. Being able to recollect in the exam in the period of so much stress, that is important. Yes.
So I did that, and I couldn't even complete your questions, all of them. So what I did was I did your questions also last 10 days. I just read your notes, reading, and then questions also last 10 days. Only additional thing I did was I did previous Marrow questions from my intern. I just took the Marrow app and did previous year only OBS questions.
Okay. So I advise students that PG level questions, at least you have to know. One of the books, maybe Marrow or Sakshi Arora, you have to practice the pre-PG level questions.
I wanted to complete Sakshi Arora also, ma'am, but
yes,
the little amount of time I had to do what really matters. And what really matters
so very focused studying you did for the last 3 months. That's wonderful. And any special advice for OBG or reproductive medicine and oncology? Any special additional books you did?
Nothing, ma'am. For 2.5 months, I'm telling you. I think it doesn't matter if you read very book, unless you want to get first 1, 2, 3, or 10 ranks. I think you just have to follow your notes.
It doesn't matter. I don't think there's much of a difference between somebody who's got a rank 1 and somebody who's got a rank 20 or 25.
Then I would say what matters is recollection, not how much you have read.
Not how much you read. Yes, you can read multiple big textbooks, but if you don't recollect, that's of no point. So,
because
yes,
I've read the whole Spiroff and I couldn't recollect anything because I was not able to revise.
There's no point in, you cannot read Spiroff again and again. That's right.
Again and again.
So this, I'll tell you, I have heard from all the toppers that though they were reading Spiroff, Williams and Berek and Hacker through their PG and SRship times, the day they decide they have to prepare for the entrance exam, that is the day when you close the textbooks. That is the day when you start doing focused reading, and only when you've got doubts, you go to those textbooks.
Ma'am, your notes is all inclusive. It included guidelines, previous questions, basic concepts. You are teaching infertility like it was mathematics. Like you are teaching that in concepts, not like I have to buy hard this.
That's so nice. Very kind of you for those lovely words, Dr. Haripriya. Yes, I have put in a lot of effort, but it's the students' efforts. With the notes, you were the one who read all of this. I have prepared notes for everyone, but you are one of the few who read them, used them properly. So congratulations to you.
Thank you, ma'am. And the best part is I have the basics right now. Like when I go for my FNB, I've covered my gynecological endocrinology, infertility. I have a good
It is going to be very helpful. I'm telling you, if you have a colleague and you have read with me, it is going to be very helpful. You're going to be a favorite of all the consultants there.
I hope so, ma'am. I hope.
I assure you. With all the knowledge that you have gained through the class, it is going to be very helpful for FNB also.
Okay, ma'am. Thank you so much for that.
So FET exam is also a negative marking question exam.
Yes, ma'am. Yes.
So how many questions you attempted? How many you left? And
I only left 5 questions, ma'am. I think I should have left a bit more. I know you always say don't leave more, but I think I should have left a bit more.
No, that's standard. I think 95 is standard. The toppers all have left from 2 to 7 questions. Most have left 90, have performed, marked 94 to 95 questions. So this is pretty standard and you've got a good rank. So that was a good decision.
Okay, ma'am, then that's good.
Yeah, I think that is a good decision. And you got an institute of your choice. So what
yes, ma'am. This is my first choice. This is my first choice and I got that.
It was a very good institute. So that is what matters in the end. How many you marked, you did not mark, doesn't matter now. You've got the institute of your choice. So I'm very happy for you, Dr. Haripriya. We did connect personally. Now, I don't want to be saying this, but all the toppers, I know all of you personally. I have spoken with all of you personally before this. I have spoken with you on phone also. I don't want to say this because then students of the next batch keep calling me and expecting personal contacts. Now it has got very difficult. Last year, it was the first batch, my independent batch, first independent student batch of students was there. So I was very interested in all of you. I did want all of you to do well, and I would personally find students who were capable of doing. So the result has not been a surprise to me. Students like you, yes,
they just have to get in touch with your notes, ma'am. It's okay if you can't.
That's so comforting that directly getting in touch with me is not as important as just reading those notes.
Yes.
That's nice of you to clarify this to the students, because I've been getting very busy with my job and personal life and the coaching. Still, I try to give my best to all the students that are there with me right now.
Thank you for that, ma'am.
It was so nice knowing you, Dr. Haripriya, and there's so much to learn from all of you all. It's to complete the notes that I've prepared, I've taken more than a year to prepare them. And then you finish them in 2 months' time. That's appreciable. That's something I have a lot of respect for. So it's nice. Congratulations for that. You're talented. You're brilliant to complete all of that, because I cannot read anyone else's notes and I cannot memorize them, understand them as well as you students have done.
No, ma'am. All I would say, if anybody wants to prepare for Onco or FET and they have a less amount of time like me, they have good amount of time, they should read your notes and build upon that. If they don't have enough time, all I would say is just read your notes, do Maro or Sakshi Arora questions, your questions more than enough. If they can recollect all of that, they'll get a good enough rank.
That's nice. That's a lovely tip from you, Dr. Haripriya. That's all the time that I want to take. That's all that I need from you. It was wonderful talking with you, Dr. Haripriya, and we'll stay in touch. We're in the same field, so we'll always stay in touch. You need anything,
ma'am.
you'll tell me directly, right?
Yeah, ma'am, sure.
Okay. That's all. I'll stop the video then.
Yeah, ma'am. But
I'll
thank
post-
you for Repronate. Last thing.
That's nice. It's so nice of you. You have made me so proud, so many results, and I'm proud of each one of you. And I know all of you, even before the exam. I'll take that credit that I know you even before the exam. I showed this special interest that this girl is going to give me a result. So